In my mind, there's no better device out there than Halo. Halo is a hybrid fractional laser that allows you to treat patients either very superficially with minimal downtime, or you get to turn it up a bit and you get to take care of patients with a little bit more downtime. So the question is, what does Halo add to the practice that we didn't have before? Okay, and the answer is, when you look at the minimal downtime lasers, we didn't have any, or that we didn't have the efficacy on the minimal downtime lasers. We had lasers that gave me great results with a lot of downtime, and I had lasers that gave me good results with some downtime, but I didn't have anything that was just about no downtime that had any result. That's what Halo fills the need in our practice. In general, people are coming in saying, I have some texture problems, I have some pore problems, I have some pigment problems. What are the technologies I can use to address these skin concerns? And with that, our job is to assess the patient's pathology, determine how much their downtime is, okay, and then figure out the best technology for that patient. Halo kind of fits the boat in most of the answers at this point. So what Halo does is it offers you minimal downtime, amazing results, and the patients are happy with it. Minimal pain to no pain. I mean, overall, it's a win-win situation for the practitioner and the patient. So when a patient comes in for their post-op evaluation and photos, when they look at their photos and they look at themselves in the mirror, the most common thing is, wow, I look great. Okay, when can I do another one? I mean, they like this. And the key to a successful technology is it works, happy patients, tell their friends. That's the key to Halo now. It works, the patients are extremely happy. Okay? It's a minimal downtime and pain procedure, and they're so happy that they're telling everybody else about it. So sooner or later, we're going to have this, sooner rather than later, we're going to have this big word of mouth of patients telling their friends, so I won't have to mention it to the patients. They'll come in asking for it because their friends had it.
Patients, after they get the Halo treatments, are very excited. I think you really have to address two things with your cosmetic patients. I think one is the dyschromia, the discoloration, so red colors and brown colors. I'm in South Florida, so we have a lot of photo damage, a lot of sun damage, and then wrinkles. Having a new device like a Halo gives you more options to treat every patient. I think the Halo is a device you can treat anywhere from 25 to 100-year-old patient with, and you can match the need of the patient, the cosmetic need of the patient, with that device. So if somebody has a lot of pigment and a little wrinkles, you're going to focus more heavily on the 1470 and not as much on the 2940, the wrinkle part of it. Or it might be flipped. A patient may have more wrinkles and just a little pigment, but you're going to get the benefit. So it really gives the physicians and the practitioners a great tool. I'll even do a BBL treatment first on the same day that I'll do a combined Halo. And you have to know your parameters and keep things a little lower. But patients come back a month later and, in some cases they can look 10 years younger, their skin is smoother, and they're very excited about it with very little downtime. And in some cases, no downtime, depending on how you dial the settings. But of course, the real home run with Halo that, again, Sciton did was having a resurfacing with a pigment photo damage rejuvenation machine all in one, and it really does a very short downtime, which again is another unique feature. If you have a patient that wants 2 days of downtime, you can do that, and you can say, when you have more time next month, we can come in and we can do a more aggressive treatment. Because as we've learned doing maintenance, I have maintenance treatments and rejuvenation treatments. So if somebody needs something a little heavier, we might start there and then give them a couple maintenance treatments a year. Other patients want to go the other way. They want to start on a less aggressive pathway, and when they have a break or a time that they want a special event that they want to do something a little more aggressive, you can do that with the Halo.
I've been involved with Halo since the very beginning. We started with the earliest patients in our office, and since then we've helped develop protocols. I think we have probably the most experience with the device. Usually we see kind of the three things: dyschromia or discoloration, we see dilated pores, and we see fine to medium laxity or wrinkling. If I see those three things, I'm thinking immediately about using Halo, because I know that in 1 or 2 treatments, you're done. You fixed all three of those things. And we know now, a year out, that the results last for at least a year. And we know they're gonna last longer because the science behind it has proven that. So it's an excellent treatment for that patient who has more than one complaint, and you want to fix all of those complaints at once. I don't have any concern about complications. I don't have any concern that the patient won't be happy. Patients are always happy when they come back. The results are always predictable. They refer their friends. They always come back for a second treatment. They look more reflective and they feel brighter and they're requiring less makeup. And that's a real thing that we can track when you look at what's ultraviolet photography and you see that they no longer have these deep freckles and deep sun damage, and all that deep sun damage has been removed. That deep sun damage acts like a sink and it just soaks up sunlight. And once that's gone and Halo gets rid of that, they're just reflective. There's nothing there anymore. There's no sun damage. And so they just reflect light like a baby. And then that's also the compliment they get the most often, that their skin looks very youthful. And I've seen that result obviously with BBL a month or two after treatments or after a few treatments, or with Profractional a few months out. But with Halo, they come back within 2 weeks and they're getting compliments from all their friends.
My patients have been really loving the Halo procedure. They always mention with the Halo procedure that their friends always comment on how nice their skin looks. They look a lot brighter because the light just reflects a little bit better off their skin. Their skin tone is more even, and so I think they get excited when their friends notice how much improvement they're getting. And with the Halo, I really haven't had any patients squirm or have any problems with pain. They tolerate the procedure for the entire procedure. Usually by the end of the treatment in the past, I think they start to feel the heat, but with the Halo, it's very comfortable. Also, what I see with the downtime is that they're healing a lot quicker. So it's really just 5 to 7 days downtime, closer to the 5-day mark. And they really have an easy time with the procedure, and so they're more likely to come back and complete their series, or sometimes, if they didn't have a good experience with the first treatment, they might not come back. So they've been really happy with, the procedure and the results, and, I remarkably have been seeing good improvement with pores, which is really difficult to treat, and I haven't been too impressed with other devices in the past, so that's something new that I'm very excited about.